Yeah, I can.
Okay, so I'm a little under the weather. First off, I just want to thank you for your service since it is about to be Veterans Day. Thank you for everything that you've done for this country and and continue to do. But
Absolutely. Thanks, Mark.
my question for you is: do you support the lawsuit to end Obamacare? Just yes or no?
Well, I'll tell you what I support. I support making sure that everybody who has a pre-existing condition can get access to health insurance, and they are not denied by insurance companies. And I support initiatives because right now we've got a number of people with pre-existing conditions that can't afford health insurance because the costs are too high. I meet them all the time. These are small business owners, entrepreneurs, early retirees, like police and fire often are in this situation. People that are going back to school, they're in between jobs, and they're caught in a place where they have a pre-existing condition, but under Obamacare, they can't afford health insurance. And so as we look forward, I have like an initiative that I'm supporting, which is called Association Health Plans, that allows small businesses to band together, to be able to work together as groups instead of you may only have one employee. And if you have a large group, like in Southern Arizona, they have 15 different chambers of commerce that have come together, and they've worked to offer 17 different health insurance plans for their small business employees. This is a game changer for people who previously did not have options. You can have a principle that pre-existing conditions will be covered, but right now it's not covered for a lot of people who are suffering. So as we move forward, I do not support the government takeover of health insurance. I don't support what you hear a number of the Democrat presidential candidates talking about, where 180 million people who like their on-the-job health insurance will lose it and will have higher costs with less care and have Medicare and other things go bankrupt. So this is a complex issue, and this often gets turned into scare tactics and attacks in order to prey on people's emotions. Each of us either has a pre-existing condition or we know somebody who has one, and we're never going back to where insurance companies can deny that. But how do we ensure that there are choices for families, that the government isn't telling them what to do, that they can afford their health insurance and they can afford their health care? Just because you have health insurance doesn't mean that you have health care. And I, again, meet many people every day who tell me these stories of how they just cannot afford their prescription drugs, or they cannot afford, their deductible is so high, they're basically paying cash. So let's figure out a way to have a robust option for families and small businesses and individuals to get access to health care and health insurance that's affordable and available for them. And while we're on that topic, actually, of the cost of prescription drugs, I want to ask the question, because this is something I hear everywhere I go. Literally everywhere I go around the very diverse state, people are talking about the cost of prescription drugs. And I visit different places, and I hear stories about people who are basically going to the pharmacy and walking away because they cannot afford their prescription. And they basically leave their prescription at the pharmacy counter, something they really need that's life-saving or for a chronic condition. Or you hear about people who are pill splitting because they cannot afford their full supply of medication for the condition that they have. So I'm going to ask you guys a question. This is for everyone to participate in, okay? This is a poll. So the answer is 1 yes, you hit 1 for yes and 2 for no. Have you ever personally had to leave a prescription at the pharmacy counter or reduce your dosage, cut pills in half because your out-of-pocket cost was too high? That's 1 for yes and 2 for no. And we'll get back to you later in the call with the answer to that. Okay, moving on. Now we have